And there we go. Okay. So it is Thursday, April 7th. This is Senate Government Operations. And today we're going to start by looking at H661, which is related to the licensure of mental health professionals. So, hello, Amaranth. Would you like to walk us through the bill?
Certainly. So I am, for the record, Amaranth Abergilly, Legislative Counsel. I am looking at H661 as passed by the House. That is posted to the committee's webpage for today. You'll see the first, just as sort of an overview of how the bill will work, the first 7 sections amend mental health profession regulation provisions within Title 26. So you see there's a little reader assistance header above each section so that you know which mental health profession it covers. And within these 7 sections, you'll see there are 3 sort of changes to the continuing education unit requirements. And those 3 changes are the same for each of those 7 mental health professions. So to begin, section 1, this is concerning the continuing education units for psychologists in Title 26. You'll see that there is in a new subdivision 2, which states continuing education requirements shall include requiring 1 or more continuing education units in the area of systemic oppression and anti-oppressive practice or in related areas consistent with the report recommendations from the Health Equity Advisory Commission required pursuant to 2021 Acts and Resolves number 33, section 5, for improving cultural competency, cultural humility, and anti-racism in Vermont's healthcare system. So that is the first of the 3 changes. You'll see the next change on page 2 with a new subdivision 3. Synchronous virtual continuing education credits shall be approvable and accepted as live in-person training. And then the third is the new subdivision 5. If the licensee is licensed in 1 or more mental health professions under this title, continuing education units completed for 1 mental health profession shall count toward the required continuing education units for the other mental health profession or professions for which the licensee is licensed under this title. So those are the 3 changes that you will see repeated next in section 2, which is concerning continuing education units for social workers. You'll see that in subdivision D, you'll see that same language about synchronous virtual learning, then continuing education requirements concerning units in the area of systemic oppression and anti-oppressive practice or in related topic areas consistent with those recommendations from the Health Equity Advisory Commission. And then the ability for a licensee to use units for 1 mental health profession for their required continuing education units for another mental health profession. So section 3 is those same requirements being added for alcohol and drug abuse counselors, again, within Title 26. And then there are some minor editing corrections there in subdivision 1 at 2, some capitalization. And then moving down to section 4, would add these same 3 requirements into the clinical mental health counselors continuing education requirements. And then moving to section 5, those same 3 requirements for marriage and family therapists. And then I'm continuing, I'm now on page 6 for psychoanalysts. You'll see those same requirements on page 7. And then section 7, beginning at the bottom of page 7, moving into page 8, those same 3 requirements for applied behavior analysts. So those are the continuing education unit requirement changes. Next is section 8. This is a study section, mental health professional licensure study. The Office of Professional Regulation shall conduct a study on 1, the possibility of streamlining the licensure of mental health professionals practicing the state, including a review of the feasibility of creating one mental health professional license with endorsements for specific mental health professions. 2, whether additional regulation of supervisors for mental health professionals in training is necessary, including a review of potential limits on areas of mental health work a supervisor may supervise based on the supervisor's own work experience and education, the rate or fee a supervisor may charge for providing supervision, and the number of supervisees assigned to one supervisor. And 3rd, the barriers for individuals who are Black, Indigenous, or persons of color, refugees and new Americans, LGBTQ individuals, individuals with low income, individuals with disabilities, and those individuals with lived mental health and substance use experience entering mental health professions regulated by the Office of Professional Regulation. Now on page 10, subsection B, stakeholder input, the director of the Office of Professional Regulation shall seek the input and recommendations of the following stakeholders in completing the study. 1, representatives of each mental health care profession associated with the Office of Professional Regulation selected by their respective licensing board or by the director. 2, the commissioner of mental health or designee. 3, the chair of the Health Equity Advisory Commission. 4, representatives of mental health care professional organizations. 5, representatives of health insurers. 6, individuals in mental health care professions or seeking to enter mental health care professions, selected by AALV Incorporated, the Vermont Commission on Native American Affairs, the Vermont Center for Independent Living, and Outright Vermont. And 7, other stakeholders, including individuals from diverse backgrounds, to represent the interests of communities of color and other historically underrepresented populations in mental health care professions. Subsection C at the bottom of page 10 is a findings and recommendations section. On or before December 15th, 2024, the director of the Office of Professional Regulation shall provide the office's findings and recommendations to the House committees on healthcare and on government operations, and the Senate committees on health and welfare and on government operations. Section 9, Mental Health Professional Supervisors Registry. The Office of Professional Regulation shall maintain a registry of mental health professionals who are available to serve as supervisors for mental health professionals in training. The registry shall begin upon passage and shall contain a complete list by 2025. And then lastly, Section 10 is the effective date. This act shall take effect on July 1st, 2022.
Thank you. Are there any drafting questions for?
This might be a silly one. It says under stakeholders, some people selected by AALV Incorporated. I'm just not sure what that is.
Oh.
Sorry if you don't know.
It's the Association of
Africans.
It's not African American.
Huh?
It's not African Americans. It's just Africans. Association
Oh, of Africans living in Vermont. Yeah, okay.
Thank you. Sorry about that.
Because we had said that in judiciary and I asked that question, yeah.
Yeah, but the fact that it's not spelled out may mean that they serve more than Africans, so they may be moving away from.
Oh, I see, so they're
spelling
just
it
using the
out.
acronym.
That could be, I don't,
Yeah.
is that true? Okay, that probably said yes. Yeah.
You had a drafting
I
question.
didn't, Madam Chair. I don't know if it's a drafting question or not. I don't see any section on definitions. And I'm curious what cultural competency and cultural humility mean. They're
So
referenced throughout.
This language comes directly from Act 33 from 2021. I would need to go back to see if those are defined terms within that act. So it is trying to tie together the recommendations from Act 33 with some of the changes required here and have the language all work together. I can send you Act 33 if that would be helpful to see how this fits in the context of the work that was completed by the House Committee on Healthcare last year.
That would be great. Thank you.
You're welcome.
So really, until page 9, it's exactly the same language, but for different
Well, they all are.
professions.
It's referenced
Except,
over. and over.
yeah, except then on page 9 starts the study.
Yes.
But,
Yes.
okay. So Representative, the House Ski?
Vihovsky.
Who?
Vihovsky.
Vyhovsky. Okay, great, thank you. I see Linda, you have your hand up?
Oh, I can explain the cultural humanity and cultural competency very quick if you want.
Well, let's hear from the representative first, who was the reporter of this bill on the floor, and she might also have some information for us on those terms. So, okay.
Yes, what would you like from me? I know every committee does this a little differently, so.
Just kind of, I guess, lay the groundwork for us, and are you on the government operations?
I'm on government operations. I'm also the sponsor of this bill.
Okay, and did it go through the health committee or the human services committee?
We had a very brief stopover in healthcare, and they actually changed the language and added those pieces around cultural humility and cultural competency. Originally, the language that I had proposed read 3 or more credits in systemic oppression and anti-oppressive practice, and they added those other pieces.
Okay, so could you just give us an understanding, your understanding of what that means?
Yes, absolutely. So
First of all, even before that, I don't think you've been in this committee before.
I have not.
So we should introduce ourselves. I'm Jeanette White from Windham County.
Washington County.
Yes.
Keisha Romney, still Chittenden County.
Brian Collmore from the Rutland District.
And missing is Senator Clarkson from the Windsor District, and she'll be joining us shortly. Okay, great.
Wonderful.
Now start and identify yourself for the record.
For the record, Representative Tanya Vihovsky. So this bill, this bill came about actually after almost a year of collaborating with my fellow members of the mental health profession. I myself am a licensed clinical social worker, and working with advocates for those who are presently underrepresented in our mental health workforce. It is grounded in some of the learning we could take away from COVID, and that is where you see some of the allowances for electronic CEU credits, which is an access issue as well. It makes those credits more accessible, and it opens the whole nation of continuing education units to our practitioners here in Vermont. And it also is, as you'll see in the study section, it's a workforce development bill, really looking at trying to ease the mental health crisis that we are facing in a way that is intentionally grounded in diversifying that workforce and ensuring that we're welcoming everyone to that workforce, which will make a stronger workforce, but also will be better for people seeking care. So that's how I got to sponsoring this bill. And the area of anti-oppressive practice, and we know systemic oppression is real, and we know it is impacting all of our systems. And putting this in this bill was in no way suggesting that it is worse in mental health care, but simply looking at mental health care professionals so frequently are working with people at their most vulnerable. And so it felt very pressing to move forward with universalizing that training. In my view, cultural competency, cultural humility, anti-racism are all aspects of anti-oppressive practice. Anti-oppressive practice is a reflective practice of recognizing our own privilege and how we bring that into the space that we are sitting with someone that we are supporting, and also reflecting on the areas where we are different and where we may share things, and creating space for them to bring their own selves into that practice. So that is why I say that cultural humility, understanding someone else's culture, or that their culture may be different than yours, and cultural competency, again, is that same idea of understanding that there are other cultures and someone's culture can be different than yours, is, in my view, part of what it means to practice in an anti-oppressive way. Are there the only other piece I wanted to add, just so you know, and I'm sure Director Hibbert will testify to this as well, there used to be another section in this bill that created an additional position in mental health licensure at the Office of Professional Regulation, and she has really compelling statistics around why that's needed. There is currently one person that manages all of the licenses for every one of the 7 mental health practitioners in Vermont. And what I heard from every single person that I talked to in the field is that that person is overwhelmed and can't manage it all in a way that is reasonable and quick. And what we heard from Director Hibbert in my committee is those requests for information and like are just going up and getting bigger. We also did hear that they can, I know that the OPR budget, and you probably know this, I probably don't have to explain this to you like I did with appropriations, is segmented. So each licensure fee pays only for their licenses. And we did hear from Director Hibbert that she can contain that position within her existing budget. So we pulled it out because we were up against the crossover deadline and didn't want it to get stalled on our side, with the hope that you would fully dig into re-adding that in on this side. So I did want to give you that background as well. We just simply didn't have time to really dig in the way we needed to against the crossover deadline.
Great.
And then I'm happy to answer questions.
I have one for you, and then we'll jump to Linda and Lauren. So a lot of the continuing education around cultural competency. I get the cultural humility. But around cultural competency, is a lot of that training available in Vermont, or now because we have opened it up and it can come from other places?
So yes, and this area of anti-oppressive practice and cultural humility is a growing area, and I know as a social worker, this has been grounded into our educational work for many years, and it's really the grounding of how we do things. And so the other piece of this bill, which allows for mental health professionals to gain credits, if I'm a licensed clinical mental health counselor, I can take a social work course. And so this is a growing area here in Vermont, and with opening this to the rest of the country, we are allowing for us to access things outside. And Vermont would not be the first state to add these requirements. There are 9 other states that already have requirements in this area for mental health practitioners.
Good, thank you.
Yes.
I can see that with mental health practitioners, it's particularly important because you are dealing with people who are not at the best time in their life.
Yeah, absolutely. And that is what I felt as well. I did get some questions when we were bringing this up, if I thought that this was a particularly, if mental health practitioners were somehow worse at this. And the answer is no, it is who they are supporting.
Yeah. Any other questions?
The only last thing I want to add, because I know it comes up a lot, that registry, the mental health supervisor registry, that's not a paid registry. What it would be is when a mental health practitioner renewed their license, they would check a box that said they're available for supervision, and then it would be held in one place at the Office of Professional Regulation. In our statute, I can, as a social worker working towards my clinical hours, can access supervision from any of the licensed professionals. And I spent almost a decade doing this work before I went to get licensed and didn't know where to find supervision and struggled to find someone. So this really just puts it in one place so that someone who needs to do those 3,000 or 4,000 supervised hours can just go to the OPR site and say, okay, these are the people in my area that are doing this. So I did want to just, it uses the language of registry, but it's not your typical, you have to get an extra license kind of registry. It is just meant for ease of the person needing to get their hours supervised, being able to find someone who can do it.
Great. Yes.
It's a very small thing. When I was looking, of course, when you start to name organizations, inevitably it feels like someone's left out. You know, at the same time, none of the groups named necessarily represent Black and Brown Vermonters who were born in the United States. So I didn't know if you felt like, let's leave that to number 7, or had thought about naming the Vermont Professionals of Color Network, or the NAACP, or Vermont Racial Justice Alliance, or any of the other.
I think any of those would be welcomed additions to this list. I think it, as you said, you know, as we start to think about things, and it started to be very large, but I personally would feel that any of those would be welcomed additions. Yes.
And this isn't a bordering, this is just who the director needs to, particularly pointed out that the director needs to work with in
creating this.
Right.
Okay.
I mean, yeah, and where I hear huge gaps are, you know, people of color who were born in the United States. And I think the Vermont Professional Psychology Network at least is trying to start assessing who is a mental health professional in that category of being identifying as BIPOC or a person of color. So it might be good to just see if there's another group.
No, I think that would be a welcomed addition and would bring a voice that is not adequately represented on this list.
Okay. Thank you.
Thanks.
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 And you are welcome to stay with us, or you are free to go back to your committee if you are doing something exciting.
That's a loaded.
If you feel like you might have more questions, I'm happy to stay. If not, I might run back to my committee to see if we're still hearing on a rather controversial charter change.
Which one is it?
The Burlington 2022 charter change.
Oh, right.
We haven't gotten that.
That's
one.
the newest one.
Yes, that is
Okay.
the newest one.
All right. So if we come up with something that we could get additional information from you, Gail can send a note.
Perfect. I'll keep my email open and I can run right back down the hall. Thank you.
No, well, yes, Amron,
I just wanted to mention that I have emailed you all Act 33, and if you look down to page 12, you will see the definitions of those terms that are referenced in this bill.
great, thank you.
You're welcome.
Linda, would you like to weigh in?
Yeah, I need to go. I was hoping that Tanya would be here to answer the question. I need to go. My person is here. So I would like to know, I want to make sure that this is not a check the box kind of deal for the CE. And I want to know who's going to approve the curriculum. Who's going to, right now, I think OPR and NASW approve CE and other people can. I think UVM can also. There's a very different, and I'm only talking about social work. If you do, psychology, the National Psychology Association can also do that. Who is going to hold that specific curriculum quality?
It's a, can I?
Yeah.
I mean, that's a great question. I was once on the committee to determine what qualifies as meeting the diversity and equity requirement at University of Vermont. It might be an Ameren question. So Ameren, if you can still hear this, I could be wrong, but I'm reading that they shall require units consistent with the report recommendations from the Health Equity Advisory Commission. I don't know if that has either pedagogical or just like parameters for what should qualify. And maybe we should have asked that of Tanya, of representatives.
Yeah, I think that Lauren can help us understand, because the Office of Professional Regulation deals with continuing education units for many professions. And so I would ask Lauren if you want to weigh in on that particular question right now, and then on the rest of it.
Sure. For the record, Lauren Hibbert, Director of the Office of Professional Regulation. The way that the majority of the continuing education within OPR is approved is it's either we approve education from a specific provider. So the Social Work Association for Vermont, NASW, all of their continuing education is automatically approved. And then we, a separate organization like UVM could put on continuing education. They would need to ask for approval from our office. We would review the curriculum and make sure it meets the requirements to say that it was approved. And there's an additional layer of complication or nuance here, I guess is the better word, is we are waiting for the recommendations from the Health Equity Commission and to what those requirements may or may not be. That's why Ms. Davis is here, because she is the chair of that commission. So I know that their work is ongoing. I know that they're in the process of forming their recommendations, but in whole, the framework would be, we would understand what the recommendations were in this area. And then if OPR is approving the education, we would be making sure that the education met the recommendations from the commission.
Great, thank you. I think that what we'll do then, before you weigh in on the rest of the bill, is jump to Susanna on with you're the chair of the Health Equity Advisory Committee. Is that okay? So if you can just tell us there how that would work in terms of approving and making sure that the quality of the continuing education units are there.
Thank you. Good afternoon, Susanna Davis, Racial Equity Director.
Susanna, can you get closer to your mic?
Yes, I will shout. It's my favorite thing to do. Good afternoon, Susanna Davis, Racial Equity Director for the state and also chair of the Health Equity Advisory Commission. And yes, the commission is tasked with looking at education requirements for the profession, particularly ways that we can improve quality of health outcomes in and cultural humility and cultural competency practices. You already have received the email of the language from Act 33, so I'm not going to read it out here on camera, but effectively the commission is going to be has been looking closely at how we educate and train and maintain awareness of differences, similarities, and promising practices in healthcare. And we're looking at it very expansively, not just as formal training the way that we currently understand it, but what education means broadly, because education comes in a lot of forms. It comes through lived experience. It comes through formal training opportunities where you fill out forms to get CEUs, et cetera. It comes through informal training opportunities. And so what are the ways in which we can create well-rounded and holistic education for professionals? Another aspect about this is, of course, we're talking about doctors and social workers and mental health workers and those who may be credentialed and have a formal role in this process, but there are a lot of people who are in the chain who are professionals in these settings that also could stand to use training, right? Pretty much anybody who comes into contact with a patient or client or member of the public can benefit from some level of education or training. And so we're looking at what are all of the ancillary professions. I'll give one sort of related example. During the initial onset of COVID-19, we were talking a lot about testing and administering the shots to people who were healthcare workers. And that often included doctors and nurses and other folks who do triage as part of those facilities. And it also included patients, but interpreters who were often in the room at the time of treatment were not covered by the institutions because they weren't on staff there, and they also weren't the patient. And so they were often left out of the chain when it came to these matters. And so similarly, when we think about who can stand to be, who should be educated or trained on matters of anti-racism, anti-discrimination, cultural humility, et cetera, we want to think not just about those professionals who are top of mind for us, but also those who are along the chain. So I'm not even sure if I've answered your question, but those are some of the ways that the commission has been looking at this. Now, there's a lot on the commission's plate, and we welcome that charge, but it means that it's going to take time. And so it would be inappropriate, I think, for me to speak on the whole commission's behalf to tell you when can we set this education standard. But I do think that they would agree with me when I say that we are willing to help set an education standard. But that's something that we're going to want to be informed by people who are in the profession. Former members of the profession are really key because it's not just about who's still here, it's about who's not and why not. So we're going to want to speak to people who are currently in the profession, those who have left, those who are patients and clients, and others who can help us to set up a really solid structure. And as well as people who have backgrounds in teaching pedagogy and education and training, et cetera. So we see this as a broad set of stakeholders who need to be engaged in order to make sure that we have a really solid plan. I hope that has answered some of this.
That you did, and the one question I would ask, given the work that you're involved in right now, and the fact that the requirements for the CE units for the mental health providers that are in here are dependent on the recommendations from would it make sense to move the effective date out from July 2022 out a little farther to give you time to do more work on it and then work with OPR or others to make sure that the training, we get the training and the education in sync with what you come up with? Does that make sense to?
Yes, Madam Chair, it makes sense and would be deeply appreciated by the Commission. Right now, we have had our sights set mainly on the reports due in October of this year, which would advise on whether and where and how to set up an Office of Health Equity. We do plan on utilizing the appropriated funds to hire someone to help us facilitate that discussion. And it's going to take a lot of our energy. So we would very much appreciate the adjustment to the timeline to allow for these various things to get the attention they need.
Okay, thank you. That would. Any other questions for Susanna? Thank you very much. Thank you. So Lauren, did you want to weigh in on the bill? And we're running a little behind ourselves here because we got off the floor so late, but so.
I can be quick. Sections 1 through 7, the office supports, although I would also appreciate the timeline push out to make sure that we fully understand the recommendations from the Health Equity Committee. I think that work is going to have recommendations for multiple professions at OPR. I fully anticipate that. So, and it may be in a variety of areas, not just continuing education. So I'm very much looking forward to that work and participating in their work to the extent that's permissible and possible, and incorporating that into our regulatory structure. Section 8 is the study, and I did send you an email, Madam Chair, about the study. There's another study that's in a bill that's moving through the legislature. It's in 703, which is currently pending in front of Economic Development. The timing of this is again another crossover sort of calamity, if you're me, mishap, if perhaps, is, we weren't sure that this bill was going to move. It didn't look like it was going to, and then it did at the very last minute. So the office supports seeking a study around mental health licensure. We know that there's work to be done around streamlining for mental health licensure. We know that we need to sit down with a wide variety of stakeholders to try and figure out how to do a quicker job getting folks into the mental health field. There's a lot of complicating factors related to mental health training and education that really introduce a lot of delay, but we want to make sure that we're doing everything we can on our side as well. So we support a study. It was put into 703 as a streamlining report. It was put here as a streamlining study, but at least the first factor in 661 is very similar to what is in 703. It's section 33 of 703. Section 2 of this study language, we also really support. That would be talking about the regulation of supervisors. That is an area that has been of discussion with our boards. These are in some ways an extension of the formal education. Perhaps think of it as, the supervisor of a resident in medical school or a preceptor in nursing. They are training future mental health providers. We support section number 3 as well of the study in section 8. We just need to be very clear, and I tried to be very clear on the House. There's a lot of things that lead into barriers for why particular populations, of which the majority of them are in this bill, although I'm sure there are more, to not enter the mental health field. Off the top of my head, I would think role models is probably the most significant. The lack of role models in the field is probably the most significant, not to mention student loan debt and complications even filling out the FAFSA form. So there's a lot of factors. And while my office, we're really the end, we can evaluate the end barriers, but the barriers that exist leading up to when somebody puts an application into my office is a harder thing for us to assess. We certainly can participate in that conversation, but I just want to be really clear with the legislature that it's an expansion of our scope, honestly, and the ability of my office to affect change is limited. Not that we can't inquire and do, the stakeholder gathering, but I have very little power and control over who UVM accepts into their social work program, for instance, or how their application is on their website, how accessible their application is on their website for someone who's blind. There's a lot of factors that are outside of my control. So as long I'm okay with the language as is, I just want to set reasonable expectations for stakeholders and with the legislature on what the report is going to be able to address. So I'm happy to, I'm very comfortable with the stakeholder engagement and, having those conversations. I just, I don't want to overpromise what we'll be able to achieve. And I think some of that work is the work of the Health Equity Commission as well. And I know that they are engaging in it. So there's some overlap, which again, I'm comfortable with the overlap. Susanna and I had a very good meeting this week about our spaces, and I'm comfortable that we'll be able to work really well together. But I just want to acknowledge that it is a scope change for OPR.
So Susanna just put a thumbs up in the corner when you talked about your meeting. And I am really stunned, however, Lauren, that we thought you were able to change the world. And now you're telling us you're not?
I'd like to be given the opportunity to try, Madam Chair.
Okay.
So I'm now on to section 9, which is the Supervisor Registry. This is something that's operationally very easy for us to implement. We will need the time frame to be out those 2 years so that so it doesn't create an additional operational burden for us, so we can gather this data through our renewal cycles. But this works well for us. And then I just wanted to touch briefly on the position that was in the bill that was taken out on the day before crossover or the day of crossover. This committee is very aware of OPR's work and our staffing, but just as a refresher, we have 8 licensing administrators, 1 supervisor over that group of 8. They handle all 50 of our professions, and we have had 8 since 2015. So I thought it might just be useful to give a few statistics. In 2015, we had 39 professions. Now we have 50 professions. In 2015, annually, we had 8,459 applications. Now we have 13,448 initial applications. Those are not renewals. In 2015, we had 54,458 licensees. We now are at 75,000 926 licensees. So those are people that we need to answer their questions and be responsive to them. Before the pandemic, we were higher, but we've lost licensees during the pandemic. Just taking those two numbers, those 2 years into account, we've had a 75% increase in professions, which is the work of this committee and your sister committee on the House, so thank you. We've had a 59% increase in annual applications and a 39% increase in total licensees. So we've been able to manage this without adding licensing staff. We have added staff into other sections of the office, but we are at the point where we cannot continue to provide our excellent customer service that we're very proud of, and we're very aware that we are the last piece on somebody's long journey to become licensed. It doesn't matter whether you are a tattoo artist and you've gone through an apprenticeship program, whether you're a mental health provider and you've been on a 5-year licensure track. We're the last piece that says you can enter the workforce and get it to work. And we really want to be responsive and turn around people's questions and get people licensed as quickly as possible. We've introduced our new licensing platform in 2017. We're still working on making it constantly better, faster, more intuitive. But I really think we're at the end of what IT can solve. I think now we need a human. And mental health, it was a rational nexus for me when Representative Wachowski came and talked to me about this bill. This bill, without an OPR bill, this bill was the rational place to put a position because mental health is where we are really struggling. Our mental health licensing administrator, if and when she retires, which of course she's entitled to do, we're in trouble. She has incredible institutional knowledge. So we need some, I'm blanking on the word, but we need some redundancy there. She also receives 700 emails a week. This probably doesn't seem like a lot to a legislator, but for someone who's trying to be responsive to a human on the other side of that email, 700 emails is too many emails to be able to triage and respond to in a thoughtful way. And I need to be able to spread out that work in some way. And it's a licensing administrator that I can do that with. We do have the money in our budget. We had a position that got reallocated, but the money has been budgeted. And so we don't need any general fund money and our budget will sustain this cost. So if this committee is inclined to add it back in, I'd be very grateful. And if this committee is not inclined to come back in, then I'll see you next January. No, I'm just kidding. But I will put it in a bill for next January if this committee does not put this position in. I would obviously come back to the committee and I hope to come into the building to come in front of your committee. But this position is a necessary piece for OPR's continued excellent customer service, which is really important to all of us here at the Secretary of State.
So I'm going to ask you that we are running a little behind ourselves right now. We have Senator Sanders' office who has to leave at 10 minutes till 3.
Oh, I'm sorry.
No, that's fine. We were just on the floor much longer than I had anticipated. And if you would come up with the language, you and Amron would come up with the language here around the position that we need to put in, then we can look at that. Okay. Are there any other questions for Lauren? And we will do this. I'm trying to find my schedule here to see if we have it on again for next week, but I'm sure we probably do.
I guess I'll just say I'd like to see the language then about the position. I just feel like that's a no-brainer and would actually help our mental health workforce.
Well, yeah, that I just asked them
Okay, okay.
to come in with language.
Yeah.
That's what I said.
second that. Okay.
So if you can come in with the language around how, because we're just adding a position, we're not putting any money in there. We're just adding.
That's correct, yes.
Yeah, yeah. And let's see, what is this number of this one again?
661.
It's not right now. It's not on the list for next week yet, but I will make sure that it is.
Okay, thank you very much for your time, and I will reach out to Amarin.
Thank you, and and then we'll put it on next week and we'll deal with it.
Okay, thank you so much.
Thanks, Amber. Thanks, Susanna.
Can I just say, well, I don't know if Susanna's still here, and it's nice to see Catherine. We have a new Supreme Court justice in the.
That was right. Did y'all
Very excited.
Did you go? We got an invitation to her swearing in. I did.
You did?
Of course I
I'm
did.
so impressed.
You don't know that I'm a really important person?
We know you're.
No, it's
Verbal
just
invite.
because I'm on judiciary and on the nominating board. That's
Oh
why.
my gosh. Are you going? Can I have
It
your
was at
ticket?
1 o'clock. It's at 1 o'clock tomorrow.
Oh, okay.
So she hasn't been sworn in yet. She's been sworn
Wasting
in.
no time.
So, okay, great. Yes.
I'm so excited.
Okay,
This
thank
is
you.
one
We're gonna,
plus of you being so.
we're plugged in.
Plugged in.
We're going to hear from Catherine now because she has to leave us in
Oh, yeah.
4 minutes. So Catherine, do you want to weigh in on post office?
Sure. I will talk faster than usual, and I apologize that I have an inflexible schedule today. So as I think the committee knows, first of all, I really appreciate you talking about this issue. It's incredibly important to Vermonters across our state, particularly those in rural areas. I think all of us have constituents who rely on the Postal Service for everything like medication, prescription drugs that they get in the mail, getting bills paid, receiving checks from Social Security. So obviously we know that the post office plays an incredibly important role in the daily lives of Vermonters. From the federal level, we're really pleased that the Postal Reform Act has passed through the Congress on an extremely bipartisan basis, very little opposition, frankly, and has been signed into law by the president. The biggest piece of the postal reform bill that should serve to help Vermonters is that we got rid of a mandate that was put in place in 2006 under then President Bush, which Senator Sanders opposed from the beginning, that required the post office to pre-fund all of their retiree health benefits. So that basically is the same thing as telling an employer today, if you hire someone, you have to pay for 20 years of their health care on the day that you hire them. It just kind of doesn't make any practical sense and created a massive deficit for the post office that meant that they were unable to invest in their current workforce and the current needs of Americans to get their mail. So the law that was just signed yesterday by President Biden gets rid of that pre-funding mandate, means that the post office will be able to take the federal dollars that they have and actually put that into paying their workers, hiring more workers, improving delivery, and getting the mail out to Vermonters as quickly as possible. Senator Sanders, of course, had hoped that that bill would be more comprehensive, more progressive. He is the sponsor of postal banking legislation, which would make it so that Vermonters and people all over the country could bank at the post office. There are a ton of unbanked people in this country, and this would be a huge opportunity to help them. Unfortunately, that piece did not make it into the final bill, but certainly we still we're glad to see that we got what we did in the bill itself. I thought if it was helpful, I would just spend literally a minute on a couple of the other pieces that we have worked on of late. Senator Sanders has heard from countless Vermonters about postal issues. Recently, we have a big casework operation where we have staff who help individual Vermonters with issues they're having with the federal government. And recently, for the first time ever, postal issues was our #1 type of case that came into the office, which almost never happens. To give you a little bit of a sense, for the 4 years from 2015 to 2019, we averaged about 35 postal cases a year. In 2021, we had 141 postal cases, and we've already had 75 postal cases in 2022. So everything that all of you, I'm sure, are hearing from your constituents, we are hearing from those same constituents. We worked with Senator Leahy and Congressman Welch to help save the Elmore Post Office, which was under threat of closing. We've also been working to ensure that we have a functional cancellation machine at White River Junction, which is particularly important in getting the mail out to Vermonters. I will say we have some concerns about making sure that the Vermont Postal Service has the workforce they need. It's been a real challenge. So we're just going to continue to make sure that Vermonters understand that the federal government is a great place to work. Working for the post office has some great benefits, and we would encourage folks to consider the Postal Service if they're looking for new employment. That being said, Senator Sanders has some major concerns about the current Postmaster General, Louis DeJoy, has called for his removal. It's not as simple as the president asking for his resignation. The Postmaster General is hired and fired by the Postal Board of Governors, which is a bit of an unusual setup. So we are still with, unfortunately, a U.S. Postmaster who believes in the privatization of the Postal Service, would like to see private corporations be in charge of the mail, which we know is just a real losing option for anyone who lives outside of a major metropolitan area. So essentially the entirety of Vermont, let alone profit making out of something that is a true, real service that people need. So I will stop there. I'm already sort of over time, but if anybody has a quick question that I can answer, I'd be happy to. And then I'm happy to come back to the committee at any point that would be helpful.
Allison, did you
I have a quick question. Thank you, Catherine. You bring us great news, particularly for White River Junction. Yes. Morale is really low. And without the replacement of the new post, or without the hope in the foreseeable future of a new postmaster, is there anything we can do for morale other than, of course, passing this bill for our treasured post office workers?
That's such a great question. I will say one of the things that we did recently was we did a video for talking about Vermont postal issues and postal workers. And one of the things that we did as part of that was we asked Vermonters to tell us stories about the postal workers that they appreciate and they love. And we got nearly 300 responses to that from folks across the state who were telling us, they clearly understand that the issues they're having with their mail are not about their postal worker. They know that their letter carrier in a rural area in the middle of Burlington, the people who are sorting the mail at White River Junction are doing the very best they can. So I hope that our postal workers know that Vermonters are standing with them, and they appreciate the valuable service that they provide, and that their congressional delegation, their members of the Vermont legislature are going to do everything we can to make sure that they have the resources they need to provide the vital service that they do.
I think it's also important to, and I'm not sure how you do this, but to ease the regulations on the postal workers. And I have two examples. They cannot, if somebody sends a letter to Jeanette White, Old Depot Road, they're not allowed to deliver it to me, even though they know damn well where I live. And our Putney Post Office used to have pancake customer appreciation days twice a year. They are no longer allowed to do that because of postal regulations coming out of White River Junction, which I assume are coming out of Washington to White River and then the supervisors there. So I think that there needs to be some acknowledgement that post offices are part of communities and they need to be able to respond to the community needs.
And maybe to finance some of the marketing, Jeff Bezos, given Amazon is benefiting hugely from their partnership with the United States Post Office Service, might help finance a whole campaign celebrating the postal service. So maybe you could put that be in Bernie's bonnet and Jeff's bonnet. Maybe the two of them could get together and do something fabulous.
That is great.
Thank you.
Yeah, thank you all. Sorry to talk and run. I really appreciate the
that's
opportunity.
fine. We were over on the floor, and so thank you.
Excellent. Take care, everybody.
Thanks a lot.
Our Madam President didn't talk fast enough. So Michael, I know you're with us.
Needed to do 78
So
RPM.
my question is, we might want to change some of the resolves.
It's possible. Well, first of all, good afternoon. It's Michael Turner, Legislative Counsel. I have with me I have with me, and I brought a copy of the news release on the signing. I have with me SR 16,
Yeah.
which I wrote for the Wyndham delegate, for the Wyndham delegation and the Bennington delegation. Oh, before Christmas.
Yeah, and we're not going to go through the findings.
This is before, right, this is before this happened.
Right, so we might want to look at this and change some of the resolves because it says including revising the retiree health benefit pre-funding requirement, and they have done that.
Yeah.
So,
I did not, Madam Chair, if I may say, I did not specifically make any comment about the current Postmaster General. If you want to do that, that's obviously your call.
I don't know that we want to. That's a little snarky, but I would like to do something about saying something about how the post offices in our communities are central parts of our community. And they need to be able to respond to community needs and community residents in, without undue regulations. And I don't know how to word that exactly, but.
So, I mean, I can rewrite, but again, I heard your comment with respect to community events and the ability to give it more flexibility with partial address, that sort of thing.
Yeah.
I could certainly put that in, but now the question becomes, so I guess the resolve concerning the healthcare, I think we just crossed out because the President addressed that this morning.
Thank goodness.
Do you want me to, I mean, I can take out or leave in others if you want to look at that and tell me what you'd like to leave in at this point and then get back to me in a couple of days or whatever you like.
Sure, that makes sense. I think the first resolve is fine, and then I would.
I was also looking at the whereas clauses.
Yeah.
I gotta find.
Oh, I don't. I guess we.
I mean, I could add it, I could, if you want, if this is what you want for right now, if I'm going to add something in about community service, and I think it needs another whereas to balance, to say where my source is for the resolve. I
Okay,
can do that and take out the healthcare if that's what you want for a start.
okay, that makes sense.
And then you can look over and decide if you want. The resolves that are in here are based upon materials that Senator Sears had been given by various constituents in Bennington County. And what you want to do with that, of course, is entirely your call.
I'm sorry, I'm trying to find.
I couldn't find
I
mine either.
can't find a file on it.
Yeah.
SR 16.
So what I will suggest maybe is that we, take, that we find our copies or get copies printed. We'll get copies printed. So that everybody has a copy, and then we can schedule it for next week and go through them and look at it.
And I can come next
see what-
week with a
Yeah.
pad with me, and I can be writing changes as we go along.
Yep. Does that make sense?
Yep.
Okay,
One thing I wanted to note is, and I can't find my copy. When I talked to the rural letter carriers led by Stanley Franklin in the state, one of the biggest issues that they talked about was delivery trucks.
Oh.
And
Oh, yeah,
they're
the
all
state of
two-wheel
Maryland.
drive, et cetera. And then this has come up at the national level because they're renewing a contract for, carbon-based fossil fuel, the same trucks that they've been using, which there's just lots of problems with. And that was the biggest issue that I heard from the rural letter carriers.
Me too. I've heard it across the boards. They want four-wheel drive in Vermont. They definitely want.
Yeah.
Yeah, they just
Four-wheel
modern vehicles.
and the other issue that I have is that the post offices should stay in the middle of the villages. They should not put post offices 3 miles out of town.
We don't even have one.
Absolutely.
Well, a lot of towns don't have post offices.
No,
You don't have that?
no, I live in Middlesex, we have no post office.
Oh,
We
okay.
get our mail in Worcester.
Montpelier doesn't have a post office.
Montpelier did it.
Oh, I was teasing.
Oh, I was like, okay, I don't know
Keisha
where
got
I've been.
this weird look on her face like, Montpelier doesn't have one. So that's what I'm gonna suggest,
what-
that we look at these and see about a whereas about the condition.
Community, and then if you want to whereas about the trucks,
Yeah,
why don't,
okay,
it sounds as what I should do is when I come in next week, I'll come in, be it with a laptop or a pad of paper, whatever, and be ready to start making changes as we go through it.
good. And I think maybe we'll try and do that a little bit on Friday. We'll see.
Next week?
Yeah.
Oh,
But I will let you know for
I
sure.
will not be here next Friday after about 11:30, so Friday, if you
Okay.
were expecting me to be here, is not good.
We'll do it a different day then. So I'll look at our schedule for next
I
week.
won't be here the next 2 Fridays, except next
Okay.
Friday morning, so if you want me to be here and involved, it can't be on Friday.
Okay, got it. Okay, we'll do, yeah.
Okay.
Thank you, Michael.
You're very welcome.
So we should make sure that,
I had it. I feel like I actually saw it in today's
Mm.
file. And I can't find it.
today's file.
Well,
I
in
know.
today's tiny little short file.
Okay. So,
I didn't make a copy today because I figured you had the folder from before, so.
Did we have a folder?
I filed mine, I've got it.
I've got
I
mine.
can't see what I looked under proposals, issues, and then H bills and S bills, and I couldn't find it.
Well, I'll make sure everybody's set up for next week.
Yeah,
I apologize.
And you're probably gonna need your device for this next conversation for.
yeah, oh, yes.
What device?
Oh, with any device you have, what we're gonna do is we're gonna take a short break, maybe 6 or 7 minutes.
Good.
Come back and potentially vote on the youth council. And then we're going to start going through the technical corrections bill.
Oh, cool.